Hi, thank you for joining us tonight. I'm Carl Schwartz, Lhasa OMS's Chief Customer Officer. We're so happy to partner with Pacific College of Health and Science to bring you this panel discussion tonight on reopening your clinic during a pandemic. Not only does this panel contain some of my favorite human beings in the world, you're also about to tap into just unbelievable knowledge and information. So without further ado, I'd like to introduce Jack Miller, who is head of Pacific College of Health and Science, who will say a few words and introduce our speakers.
Thanks, Carl. I appreciate it, and I appreciate everybody's attendance tonight. Before we get started, I want to say that we planned this seminar prior to when the whole world affirmed that Black Lives Matter and that change is definitely afoot. I want to acknowledge that because not to acknowledge it, the wounds and the indignation, and really the potential for profound changes in our society that can affect our patients as well as our practitioners as we continue to work and go back to work would really miss the point of being healers. We're planning some programming in the future and not too distant future that will more directly address Black Lives Matter in our profession. But tonight we're here to work on opening your practices and the great potential that will yield for all of us. I'd like to introduce four wonderful practitioners, and the introductions are a bit long because they're so great. So I want you to bear with me here because I really want to recognize their accomplishments and what they're going to bring to you tonight. Dr. Avery Nough is the owner of Advanced Holistic Center, one of New York's premier integrative medicine centers with locations all across Manhattan. She's a New York and Florida state licensed acupuncturist and doctor of acupuncture and traditional Chinese medicine. She graduated from Pacific College of Health and Science and has been in practice for 16 years. And I'm very grateful that she's hiring and mentoring many beginning acupuncturists during that time, many of them Pacific College grads. She holds a BS in Health Sciences from Hunter College. She majored in medical laboratory science. Arena and her Holistic Health Center have been featured in Forbes, Bustle, Shape Magazine, Elite Daily, Southern Bride, and list goes on and on. So Arena, thanks for joining us. Next is Dr. Lamia Kamel. She's the director of acupuncture at Aligned Modern Health, a leading wellness center in the Chicago area. So we're moving east to west here, with 18 locations. She's an associate professor with us at Pacific College, and she teaches in our program, doctoral program. She's also the chair of our Department of Clinic Practice at the Pacific College Chicago campus. She graduated from Scripps College with a bachelor's degree and then also did her master's and doctorate at Pacific College. Dr. Kamel has published original research on the role of integrating acupuncture and chiropractic medicine to treat chronic pain. She served as both the vice president and president of the Illinois Acupuncture Society, for which we're grateful for her service, and promotes awareness of the medicine, protecting rights of acupuncturists in Illinois. She serves as subject matter expert for the NCCAOM, writing questions, which all of our students appreciate someone with her expertise and objectivity on that exam. Her clinical interests range from treating pain, digestive health, neurological disorders, mental health, and more. So welcome, Dr. Lamia Kamel. Next is Dr. Nell Smersina. And Dr. Nell, if I butchered your name, please allow me to, you can correct me when you come on camera. I won't have a problem with that. Thank you for introducing yourself at Symposium and also for your work as the president of CCAOM, which is our California State Oriental Medical Association, or Medicine Association, I should say. She's a practitioner, educator, and advocate in the integrative medicine arena. She received her master's and then her doctorate at Emperor's College in Santa Monica, where my dear friend, Jacques Moramarco, is academic dean. Now, you might want to know he was my first acupuncture teacher in 1983, which was right around when you and were probably leaving the maternity ward with your mom, maybe. She's the founder of Peak Integrative Medicine, a private practice in Beverly Hills. She offers an exclusive experience for those wishing to reach optimal health with the use of many integrative therapies. She works as a consultant for different herbal and supplement companies, as well as teaching orthopedics for acupuncturists and serving as a speaker to expand the public's knowledge of our medicine. She works with the veteran community, which I'm also very grateful for that work, and something that we're very involved with as well. And is one of her favorite ways to use her skills outside of her practice, and we definitely admire that. She's excited to add serving on the CCAOM board to the list of being heavily involved in this important community, and we're excited to have her on CCAOM's board as well. And last but not least, Dr. Ra Adcock is the executive director of CCAOM. Ra practices at UCSF, where she is now, I think, in the Benioff Children's Hospital, where she serves on the Progressive Integrative Pediatric and Palliative Care team, and also participates in clinical research in the Pediatric Oncology Department. And this is very interesting. Currently, she is the lead clinician for a 3-year, $3 million PCORI study that will assess the efficacy of acupressure to relieve the most common symptoms associated with cancer therapy. Robin Ra Adcock graduated from Pacific College's doctoral program. During her time on the CCAOM board from 2014 to 2016, she focused on engaging students in schools, developing faculty membership category, offering continuing education events, and creating a series of regional conferences to help gather together the profession. I know from personal experience seeing her work that she's been a very, very positive influence on the profession here in California, and really serves as a role model to any acupuncturists that are listening, and particularly maybe the newer graduates who are looking to how to get involved in our profession. And lastly, she served as California representative to the American Society of Acupuncturists, and she serves on the California Acupuncture Coalition. It's the largest TCM pediatric oncology study ever conducted. So as you can see, none of these people have anything to keep them busy, so that's why they're here tonight with you. So I really look forward to hearing what everybody has to say. I'm going to turn it over to you all, and thanks for coming.
Thank you so much, Jack. So my name is Jeff Bloom, and I'm Education Marketing Manager at Lhasa OMS, and I'll be moderating our panel tonight. Thank you, everybody, for joining us. So we're actually going to start on the East Coast with Dr. Irina, and Dr. Irina is just going to tell us a little bit about how she has weathered the storm of the pandemic, how her practice is doing now, what she's been up to, and we're looking forward to hearing a little bit about you.
Hi, everybody. I want to definitely thank you all for inviting me to join this amazing panel of speakers. I am humbled to be a part of it. I see myself as a regular clinician. I've been in practice for over 15 years, and my practice went from just being a solo practitioner to needing help. And this is when I turned to PCAOM, Pacific College, and I asked actually Cynthia, I need help. Can you please send me someone? And things started to evolve, and I started getting assistants who will help me with the notes and turn over the rooms. And then once they graduated, I felt that I had amazing people on my team who were able to work and treat my patients side by side with me. And I will say that knowledge is everything. And the more you learn different techniques, different styles, learning different professions, working with the chiropractor is amazing. Learning something from your physical therapy friend is amazing. We created this functionally effective way of helping people and being very efficient, because in New York City, you have to get things done, you have to deliver the results. So the way my practice grew is by just welcoming everyone. We open early, we're open late, we are open on the evenings, like 9 p.m. and weekends. So when the COVID came about, it was a complete shocker to me, because what do we do now? We treat people over and over. They come to us for months. They become almost like our family. They send their relatives, they send their parents and the children. I actually had a family come to me through this whole COVID situation. So I did close my practice for a few days, and pretty much all of my employees stayed home when this thing became a big problem. I didn't want anybody commuting and coming to Manhattan. I do live in Manhattan, very close to the business, so I would take a short walk and not expose myself to anything. And I went in to see the building was dead, nobody's there, everything is closed. But I did have my patients reach out and asking me, am I able to see them because somebody pulled their back and somebody's not feeling well, they're having an anxiety, or the child is having severe allergic reaction. And I was thinking, what do I do? How can I let my patients down? Because I signed up for it, right? I said I'm going to be there for my patients. So for me to leave them be, and it wasn't an option. So once the communication started going back with emails, and it's probably because my doctor friends have a little bit more concrete information than us, to be honest. They would forward me emails about government and the laws and the options. So I had emails from my physician friends, and there was an option to submit a request to be an essential business. So I followed that link and I submitted the request to be an essential, and I explained why I'm essential, because I can definitely help people stay out of emergency rooms by administrating acupuncture treatments for panic attacks, right? People had the shortness of breath thinking they have COVID when it's just an anxiety. So I think this was like one of the biggest things I've done over these months. So once I got the reply that said, if we didn't tell you not to work, you're essential, I went out and I started treating, and I was there by myself all this time. And I won't say that I was very busy, but I had enough patients to come out for about 3 days. And most of them, like I said, they were people with probably emotional issues or from overworking and just pulling their back and not being able to move. In regards to feeling safe, I personally think this is what we always do. We always practice clean needle. We always practice presume that everybody's infectious. You always wash your hands. You always wash your tables. It wasn't that much of a change for me. I have huge space between treatment rooms, and I would not put people back into the table. I would clean everything and doorknobs. People would wear gloves. I would wear gloves. So it wasn't a big deal, but more information came out with more requests. So now I have a station in my office with extra mask if somebody comes in without them, with their gloves if they want to take some water. There are a lot of precautions you can take. I think this is just our general mindset. This is who we are. I do think we are essential. I don't see how we can be any less of an essential workers than anybody else. I actually think that we are more so, because we should be the frontliners, because we take care of people before they get sick, and working on the immune system and helping their stress level to be stable so they don't crash is our job. I'm definitely the one who will just not stand down. I will stand up and go to the front line. I wish they would let me into the COVID floor, to be honest. I would love to do research to see how much acupuncture can do for people. Why some people are getting sick and the others are not getting sick. Really pick me. I want to do that research, because we can probably identify via Chinese medical diagnosis who is most susceptible and who isn't. So I do know a lot of friends who were sick and they recovered. So not everybody gets really sick. I think being not fearless, but having certainty and a sense that you are okay because you are going out for the right reason. If you have it in your heart, you almost feel invincible. So this is where I am. And I just brought a few people from my team back. I must say I don't have several offices at that point, because it's very difficult in New York to sustain the overhead for different locations when you don't have enough patient flow. But we are operating full-time, 7 days a week out of one location in Wall Street. And I do have my administrators, and I now have 2 acupuncturists who are treating now, actually. I have a chance to speak to you. Things are moving along. I see a lot more movement in New York. People are coming out, and people are coming to us, and people are emailing, are you seeing patients? Are you okay? Are you open? Are you guys safe? What are you doing? So there's definitely hope. And I also feel like we are stronger now. There's always light that comes out from the darkness. So people are feeling more supportive of each other. There's a lot more unity, even with the chaos that we have everywhere.
All righty, well, let's get moving on, Irina. We're going to come back to you in a little bit with some questions. So Lamia, why don't you tell us a little bit about you, your practice, and how you have fared during the pandemic? Oops, you're muted.
Just making sure you're paying attention, Jeff.
I am.
I feel like, Irina, we should probably hang out because, or maybe we shouldn't hang out because I think we're a little too similar. We could get in trouble. So yeah, this has been a wild experience for everyone. We were kind of in a similar boat in that we actually never closed completely. So we kind of, when things were starting to change and change so quickly in March, we had to make the executive decision to temporarily close some of our clinics. So probably similar to what you did, Irina. But we knew that we were essential healthcare workers. Our clinics are chiropractic, physical medicine, functional medicine, massage therapy, and acupuncture. So we knew some aspects had to change, right? Massage therapy was probably out of the question because no one's going to be in that close proximity for that amount of time. So we had to furlough those folks. They're still on our payroll. They're just, furloughed right now. And then our functional medicine docs, we knew that they could kind of work remotely, right? So it didn't really make sense for them to be in the clinic just so we could kind of limit how many people were coming in the door. So we actually moved them all to remote, which I'm kind of jealous about, but I think it's been good because their patients are still getting all the needs that they have met, and our docs are able to stay and work and take care of folks. And so really it left the chiros and the acus in the clinics together. And it's been a wild ride, but we kind of said from the beginning that we would limit sort of who came in based on if they were, if it was necessary, right? So the concern is always that, if there's something particularly acute that could turn into something worse, right, then we need to address that right away. If there are things that we can address through telemedicine, we did. So that was another big pivot. Our functional medicine team actually had started piloting telemedicine a couple months before. And so we had the framework set up actually within our system, which was really cool. But I never in my wildest dream imagined that I would be doing telemedicine for acupuncture. I want to touch people. I want to feel their pulse. I want to have them see my face, but actually see my face. I want to smell them. All the tools that we're used to using. It was really hard to kind of get my head around that. But there wasn't an option, right? So you figured it out. So folks who were, kind of just a little stressed, but also were very limited on, their comfort of coming into the clinics, we went to telemedicine. And then of course, those who were sick, we went to telemedicine as well. And, we just really got to sharpen our other tools that we have in our toolbox. So I started to play a lot more with herbs than I probably usually do, it was great, right? I forgot how much I love playing with herbs when I'm so busy. Like I don't play with them as much. So folks who were really sick, actually, I think they were the most satisfying patients in many ways because I was able to work with them without touching them, without putting a needle in them, and they got better. And their fears that they had about, is this coronavirus? Is this not, right? And this was in the early days where we didn't have, in the early days, right? 2 months ago or whatever, where we didn't have access to a lot of the tests, right? So we had to be able to, kind of work on our feet. And they put their trust in us like they always do. And, those folks got better, which is really cool. And now they have this whole newfound appreciation of herbs. From another logisticals perspective, we opened our online site to sell herbs and supplements that we have so that our patients could have access to that, the ones that are kind of our private label. And then of course, we started working with Lhasa for their fulfillment as well. And then the other companies that we already work with. So really trying to make sure that there was maybe, a slowdown in treatment, but not a complete stop. And that was the most important thing, right? We worked so hard to create the momentum of change in people's lives. The last thing we wanted to do was to see them completely stop. I think to your point too, Irina, we had a lot of folks who really needed our help and saw this as a really great opportunity to make some big changes. I will say the transformations I've seen in people in these last couple of months are unlike any I've seen in my clinical practice up to this point. It's been really it's been phenomenal and exactly what we need as clinicians too, right? Because, you know, there's so much uncertainty for sure. But what I am certain about is that our patients need us and they're so, so grateful. You know, as we've been starting to open up clinics again, our patients are just, you know, chomping at the bit to come in, and it's been really lovely to see that. You know, when you worry that people are, you know, are just going to stay at home and they're going to kind of keep to themselves. No, they know how important we are to them, and we have to remember that we're important parts of their lives. They're important parts of our lives. So that's kind of, those are some of the big shifts that we did in this past couple of months. But I'll leave the rest for our conversation, I think.
All right, thank you, Lamia. And now we're going to move on to Nell. So Nell, can you just share with us how you've been doing?
Okay, so I'm so happy to be part of this panel. You guys are amazing. I've met some of you before. Everybody who's here listening to this information, I've already learned so much from Irina and Lamia, so I know you're getting great value too. So yeah, I have a solo practitioner practice here in Beverly Hills. Actually, before COVID, I was in the process of looking to bring on other acupuncturists. And so it was a real major pivot when COVID happened. I had also been looking at a larger medical space and a full build out. And it was, you know, literally in the process of looking at leases. And then COVID happened. So I stayed open. I made the decision for very similar reasons to what Irina and Lamia already spoke to. You know, there was a lot of confusion around this in the LA area and everywhere really, right? So the LA governor was talking and said, okay, non-essential healthcare needs to shut down. And my specialty as an acupuncturist deals a lot with post-surgical work. So all of the surgeons around me were like closing their offices unless they were emergency surgeries. So I wasn't really getting to dive into my specialty as I normally would, but I knew that patients still needed care. And someone specifically asked the governor during his press conference, well, what about like physical therapy and what about chiro and acu? And he said, look, we're trying to keep people out of ERs. So if you have the ability to help people and keep them out of the emergency room, we would love you to stay open. But that being said, you have to kind of make your own decision. And I felt very fortunate that I was in a position where at that point, it was really just me aside from office staff. And so I was really able to control patient volume. I don't have a very high volume practice. I do a lot of in-home care, more of a concierge type practice. So it wasn't a huge shift for me to just say, okay, I'm only going to have one room going at a time, or I'm going to spread patients a little bit more. But I think the biggest thing that we have in our repertoire, like our power, is the ability to spend time with people and communicate with our patients. And there's so much fear around reopening or around how do I shift things and what disinfectant do I use? And what if someone comes in contact in the hallway and do I need a waiver? And I get that. I get that it can feel scary because any type of change that we're experiencing, it's going to be different. It's going to require adjustments. But because we spend so much time with our patients, because we generally do have a good relationship and can have a real conversation and not just a quick 15 minutes in and out, you're able to quell a lot of those fears and really minimize the possibility of something happening. You know, if you look at statistics as far as like, okay, you're much more likely as a healthcare practitioner to be sued if you've upset a patient. It's very unlikely with the type of dynamic we have in this profession with our patients that we're going to have that type of a situation. And I think that's really something we need to lean into rather than the fear at this time, because we are able to have those real conversations. And I would say in my practice, I'm cleaning in front of patients more than I used to. I used to do that a little more behind the scenes. I didn't really have to talk a lot about the, clean procedures that I was doing when they weren't there. And so I'm having more conversations about that. But, I was telling Irina and Jeff on a call earlier today, my patients joked with me when this first happened, like, oh, Dr. Nell, you washed your hands before it was trending. And I think we need to remember that we are healthcare practitioners. We are in a space where we do know how to keep things clean and safe. And I'm also a big proponent for leveraging your resources. And what I mean by that is something like just getting on this panel right now and, you know, listening to what other people have to say, or having conversations with other people in our industry, you know, whether it's your state associations, ASA, NCCAOM, so many people are putting out information right now. And so even though there wasn't a ton of guidance from our boards necessarily, or from the government at large, and it's kind of up on a local level for you to figure out what's going on, there are a ton of resources out there and some really good conversations that are being had. And the last thing I want to say just kind of about this pivot is I think it's made us all take a second about, okay, how do I really want to run my practice and how do I really want to spend my time? And I always knew that I didn't want to be a full-time practitioner. I love coaching students and new practitioners, and I love public speaking. And so I took a lot of the time, because I was at reduced capacity, probably a third or a fourth of my normal patient volume, to finish 2 ebooks that I had just said, like, oh, I'll put that on the back burner to, you know, start writing again. And, you know, I got all fired up when this first happened and had to write for Acupuncture Today about how people weren't doing enough customized herbs. So I think we all have these things that we're passionate about, and it's been a good recheck period where you just kind of have to check yourself. And you know, what Lamia had mentioned about seeing dramatic patient results at this time, everyone's going through that same experience of having to pivot and kind of transform things a little bit. And so we have a great opportunity as being the guides for patients, and they can be, you know, the hero of their own story. So that's. Jeff,
Sorry, I was muted. Yeah, I realized that. We'll get there. So Nat, thank you so much, Nell. Ra, let's go to you. So please tell us about your experiences, since it's probably going to be very different from these other leaders.
It is, yeah. I think I'm here representing a major medical center type of practice. So while I've had other practices, I've been at UCSF for the past, in different ways for the past 5 years or so. And the team that I serve on now, the IP3 team, the Integrative Pediatric Pain and Palliative Care, is a very unique and special team. There are very few like us across the country. And we're a collective of physicians, pediatricians, anesthesiologists, clinical psychologists, specialized nurses. I'm the only acupuncturist at the hospital, and so it's a unique service, and it's a consult service. So in hospital terms, that means that you have your primary team, and then when the primary team sees another need, they will consult another service, maybe neurology, maybe psychology, or maybe our team, the integrative team. And we show up with a very robust and diverse set of tools and practitioners that help patients that are either experiencing very significant pain that's difficult for the primary team to manage, or unique pain situations where maybe someone needs opiates, but they can't take opiates, but they need that kind of pain relief. And then also palliative patients. And palliative care is very serious end of life or long-term severely debilitating disease process. So when COVID happened, it was time for our team to sit down and talk. And of course, there were all the restrictions. I'm in San Francisco, it's UCSF that I work at. And we took some time and said, what should we do? And because I am developing this service with incredible support from the hospital and my team, but really in terms of what I call the acutherapy service, I had a lot of freedom to decide what was the best. And at that time, I felt it was in the best interest of our patients to hold service once the restrictions were put into place while we figure everything out. And while I can be very outrageous personally, when it comes to my practice at the hospital, I am very conservative because this is new, because I don't want any missteps along the way, and because I have a very long-term vision of how to forge a path and a model within a hospital that hopefully can be replicated at every pediatric hospital and beyond in the country. So I decided to be very conservative in that and shut the service down temporarily while we figured and sorted out through what was really going to happen with this pandemic. And, you know, I think back to one of my teachers. I did my master's at AMC Berkeley and my doctorate at Pacific College. And one of my teachers, Dr. Emi Zhu, said, you know, Chinese medicine she's 80 something, right? And she still is teaching. She's incredible. And she said, Chinese medicine has lasted this long because it's so flexible. And in that moment, in moments when I have questions and I think, what's my guiding force? I think about that. And I think, okay, we have so many things we have to offer. And I'm a manual therapist. I love touching my patients. I deliver primary manual therapy. My scope here, my privileging does not include herbs. So it is very much rooted in manual therapy. And yet I realized there's a lot to offer our patients via telehealth. So I went to that model and was supported in UCSF with that, and decided, hey, let's develop tools through this time that will only serve our patient population after we are on the new norm on whatever this is. And so with that, I developed acupressure guides, acupressure seed guides, including all the research for it, guides for parents and caregivers about how to do it for their children, guides for our older adolescents about how to do it for themselves. And in all of these telehealth visits, and I was doing both, I do inpatient and outpatient care. It was interesting. There were times where they would bring a computer into the patient room, right? And I helped a patient, several patients through bone marrow transplants, just guiding the parents on how to do acupressure with kids. And it's just incredible to see how much of our medicine is accessible by anyone. We know we have really specialized training. We know how long it takes to really get this medicine. It's a lifetime. And yet there's so many tools in our medicine that people can learn in 5 minutes. You can learn 3 points in 5 minutes that can make an incredible difference in pain or anxiety or other symptoms in the life, especially of children, but I think for adults as well. And so I found it as a time to innovate. And that's very much what this UCSF is about, which is why I work here and love it, because it's how do we respond to this? How do we respond responsibly? How do we always put patient care first? And how do we innovate through challenge to create new tools that we never imagined before? And that's some of the things that our team has found. I've been back to work. You can see one of the changes. I used to dress more like an attending physician, and now I dress more like an intern or a resident. So wearing scrubs, hospital has given us all scrubs, and I bought some of my own, and that feels like a really good change. Normally, I'm in a private conference room, but otherwise, everyone is wearing surgical masks in the hospital. If I weren't alone in this room, I would be talking to you through this mask. And so some of the things that the hospital is doing, to give you guys a sense, is we do pre-screening. So anyone that's coming into the hospital has to answer a series of questions, either at the door or pre-screening on their phone, that basically asks about exposure within the last 14 days. And I see there is a question about this, from Young Won. And, for us, if there's been any exposure in the last 14 days, then as staff, we don't come in. And as visitors to the hospital, only one visitor per patient is allowed now, they don't come in. So there's a pre-screening at the door. There is gelling before you touch anything. And then after you gel, you put on a surgical mask, and that stays on the entire day. I've cut my patient population significantly, reduced right now as a stage 1 reopening. And again, it's a work in progress, right? So I don't have all the answers right now. I don't think any of us do, but it's constant evaluation and reevaluation and seeing things as temporary. So in stage 1, now I'm not seeing patients that have any type of respiratory things happening. So high flow nasal cannula, intubation, tracheostomies, CPAP, BiPAP. I'm not seeing that patient population, which unfortunately reduces a lot of the patients I would normally be seeing and supporting. And that's hard for me. That pulls on my strings, because I know I have amazing tools to share with these patients, and yet it's not in anyone's best interest right now for me to see them. So this has been the hard part of making these decisions, and yet I feel that it is a good decision. And I'm not seeing any patients that are on precautions. So I'm trying to use as little protective equipment as we can, because while the curve is coming down and flattening in San Francisco, as we reopen things, we'll see what happens, right? And we can expect a rise based on testing, and also just perhaps more exposure as we reopen. So we're very much guarding our protective equipment. So if patients are on enteric or contact precautions, I'm not going in and seeing them, whereas normally I would. And so that's also a difference. So I still have more patients on my list than I can see in a day, because the service is in such high demand. But I've just come back and been more modest and more conservative in how I've approached things, and trusting that there will be stage 2 and stage 3 of reopening and coming back. So those are just a couple things. I think it's always a concern. Asymptomatic exposure is one of the biggest concerns I have. And I saw a patient a few weeks ago who had a direct exposure from someone. I'd seen them and I had the slightest bit of a sore throat, and I went and got tested before I saw any patients. So a possible exposure with a possible symptom is enough to trigger getting tested. And so I think I'm so glad to see there's more testing centers available in California, and I think in other places, because I think we should not second guess. If there's any question that maybe I had an exposure, then that merits testing before more patients are seen, because we have to do no harm. That is the root of our code.
All right. Well, thank you so much, Ron. Thank you for everyone for sharing just that, little introduction. We have a lot of questions here. Some of them were actually pre-submitted by some of our lovely guests, and actually some have been submitted through the course of the webinar. So let's get into it. So Irina, I'd like to hear a little bit about some of the concerns that your patients have had. So some things that patients have been, kind of coming to you and saying, their concerns about coming in to see you.
Unmute. In regards to safety,
Yep, in
concerns
regards to
about safety?
Clinic safety and measures that you're taking to keep them safe.
Yes, we definitely had a few people reach out and ask us, what do we do for safety? And I did not mention that initially, besides the fact that we provide gloves and I actually have a sink that anybody can walk over and wash their hands first thing that they do. I do have uniform for everybody who's working. So when we come to work, we change into uniform. Everybody, the shoes included. So nobody who works is in their outside clothes. So you don't bring anything from the outside. Let's see. I do offer shields and whatever safety masks they choose. The gloves, I saw somewhere in the questions about the gloves for the patients. I let them choose what they want. They want to keep gloves on. Like there are plenty of points that we can use without having to go into large intestine for. So I do encourage them to do whatever they feel safe. I definitely spray extra. It's like I'm pouring Protex. Actually, Protex is one of the best cleaning agents that I've found so far. It doesn't leave any residues. So we do extra wiping on that. That's pretty much it.
Alrighty, and then Lamia, what about you?
Not surprisingly, a lot of the same things. Our folks are also wearing masks. I think that's the other piece. And then we have masks available for folks as they're coming in if they don't have a mask on. So all of our patients know ahead of time that you're expected to wear a mask. They know the precautions that we're taking, similar to what Ra had mentioned. If there's any contact in the last 14 days, they're asked not to come in and to schedule a telemedicine appointment, and we actually have them sign something when they come in. So I know it feels like a lot, but it's, we want to kind of go above and beyond on the same, I feel kind of the same way that we all do on this panel, is that let's make them feel as comfortable as they can. And I think right now, a lot of it is just sort of perception, right? So their perception of safety is really, really important. And obviously us doing it correctly, right? But like you said in the beginning, Irina, that's part and parcel with how we practice anyway. So, I think I still have, I used to, for the comps tests at PCOM, I used to do the ENT portion, right? So I used to test people on it. So I think I still have in my head the idea of Purelling after everything you touch, right? So, thankfully I use good moisturizer because I can still see my hands. But, I definitely, those first couple of weeks are rough, I would say, good Lord. I think one other shift that we had was I never displayed the Clorox wipes. I thought they were so ugly looking, and I'm big into aesthetics. So I just hid them, or the Steri wipes or whatever. And now they're prominently displayed, right? Everyone needs to know, there's no question about it. And then of course, following, the procedures with that, after you're wiping, you have to wait 4 minutes before you bring somebody in, that kind of thing. But the mask thing is tough. And I always have at least one. I wear blazers, so I always have at least one in my pocket and then one on my face, just in case. Also, I try to coordinate. So you got to have fun with it too, right? As much as you can, because it's not easy to breathe with them. And then we have air purifiers in our room anyway, because we do use Moxa in our clinics. So we'll turn those on while they're sitting with the needles. I do not have them wear masks while they're sitting with the needles. I wear mine, but I do not have them wear theirs, because I think it's really important. If we're talking about chi, we're talking about oxygen. They kind of need to be able to breathe, and it severely limits that. So we have the air purifiers, but again, we're following the same CDC rules that everybody here has read ad nauseum at this point. Yeah.
All righty. Ra, this is specifically for you, but what were your biggest concerns for going back to work?
My biggest concerns?
Mm-hmm.
I work with kids, and I work with a lot of immunocompromised kids anyway. So outside of this, my biggest concern was being an asymptomatic carrier and having exposure from one patient. Now, all of we're currently not doing the ambulatory care. So I do usually see outpatients every now and then for pain management, chronic pain, regional amplified pain. I'm only doing inpatient care right now. And all of our patients are tested before they're admitted, and then they're retested if there's been possible exposure or depending on how long they're here. However, each patient can have one visitor coming in and out, and then all of the providers are coming in and out. So even taking as great care as we can, my biggest concern would be being an asymptomatic carrier for a few days before I became symptomatic, not realizing it and possibly spreading it to my patients. So I do follow such incredible beyond CNT because I work with such severely immunocompromised kids. So I'm wiping down everything before and after all the time, 5-minute scrubs of the hands, almost surgical type of scrub. And but that was really my biggest concern, is possibly doing harm. I will say though, after being in the nest for months and going to the grocery store and coming back and having that feeling of safety or whatever it was, there was a piece of me coming back where I had anxiety. And after my first or second night, I came home, and even though I had no direct reason to feel concerned, I had a generalized anxiety those 2 nights. And I would run through my day and say, where did I mess up? Where was I not careful enough? Where did I not think about the things that I've never had to think about before? And then I noticed that after about a week, that started to normalize. So I did know that in returning, I had anxiety. I had anxiety for part of the first week back. And now I don't feel that. It's almost just business as usual with a lot of changes.
Can I say something about that too?
Please.
I think I 100% agree with you, Ra. I think that was something that I fought, and I kind of was checking in with my clinicians about as well. My wife works with us, so every night we'd come home and be like, how are you feeling about this? How are you feeling about it, right? It's hard not to think about that and to be concerned about the asymptomatic carrier aspect. And I think what CNT taught me is just to be as obsessive. And then we, of course, now we have all these new layers of obsessiveness, right? But we're kind of, I don't know how you guys practice, but I'm kind of an obsessive practitioner anyway. It's like the needle has to be turned the right way. It has to go in the right order. I have to take them out in the right order. So again, this is sort of how I roll as it is. But yeah, I definitely remember those first couple of weeks where we check in with each other, because we had the option. If people felt uncomfortable, we were very comfortable to say, look, you're still on the team, of course. We don't want you to feel uncomfortable. Please don't come in if you don't feel comfortable. And probably after that first, maybe 2 weeks for us, it's hard to say because it was like in the thick of the crazy. We were finally like, okay. And we have a 16-month-old at home, right? So we were thinking about that too. What about his safety? And, there was nothing known about kids at that point. I feel like there's barely anything known now, but there was absolutely nothing then, right? So I 100% agree. And I'm just lucky that we're both obsessive when it comes to that stuff. So it made it a little easier for sure.
All right. Well, Nell, I'm curious. So how have you pivoted your practice, and what is changing moving forward for you because of COVID-19?
So I, every once in a while, would do telemedicine before, because I do also practice functional medicine, and that's an easy thing to do virtually. What I was very surprised with, however, is, even though I stayed open this whole time, I felt the mask was so impersonal. And so I changed all of my new patient visits to an online consult before they came in the office. And it was really helpful for me, not only to really connect with someone, without having to worry about being 6 feet away from them and having a mask on, because normally my new patient consult, it's like 90 minutes. So I didn't really want to do that with a mask. I was very pleasantly surprised by how much of a connection you can get in that virtual consult. And it really eliminates a lot of the distractions. Like even the distractions of someone in my office, like commenting on supplements that are on the wall or the degrees or educational material. It was really a nice thing that I'm going to continue to incorporate. So now all of my new patient consults are done virtually. And then once the treatment plan is developed, it's okay, are you coming in for acupuncture, or am I going to order blood work? And then we're going to follow up in a month. So I've loved that part of it. And I'm also looking at a different office space, because before this, the plan was, this big build out, and I'm going to have all these people working for me. And, this is the way I want to go about it. Now it's made me reevaluate, okay, do I need a huge waiting room? Like Beverly Hills per square foot, it's not cheap. So I don't want any unused space, right? So if we can't have a ton of people in the waiting room, and we're trying not to, run the risk of exposing people or make them feel unsafe in any way, there's no reason to have that. So it's really forced me to look at different things that I wasn't placing a lot of importance on. And now I am. And it's been a kind of nice little reset button to just say, oh, you know what? I do like talking to someone virtually. And when they're in the office for acupuncture, it's just for the acupuncture session.
All righty. Anybody else? Would anybody else like to talk about that? Okay, so we can move on. So I'm curious, and actually, Irina, have you seen that patients are presenting differently during and now kind of at the, coming out of the COVID?
Patients presenting differently? Oh, I don't
Yep.
understand.
Are you seeing different chief complaints? Are you seeing, different types of patients?
Probably different types of patients because of where I am, Wall Street, Manhattan. The majority of our patients were the people who come into the city for work. So they are not here. And they actually did tell me that they are not coming back until September, October, maybe even later. So it definitely, we had a shift into more residential patient population. And it's usually, like someone mentioned in the beginning, it's like because they can commit to much more frequent sessions, it's amazing that you can see the results. And also I'll have like a whole family come in, mom, dad, and 2 kids, because they have a serious dynamic at home because they're stuck in a small space. So I've had mostly families, believe it or not, like literally husband and wife, because they're having issues. They're not getting along because they're in such a small space and the kids are freaking out from being at home. A lot of emotional stuff for sure. I feel like this was like the main thing that I was working on so far. And precaution wise, maybe New Yorkers are fearless. I literally had one patient who asked me, what extra are we doing to be safe? And I give them the right to put whatever they want on themselves and gel up. And I am always my way. I am clean. I am protecting them from me. If they want extra layers, they do that. But mostly I would say like maybe 1 or 2 people from extreme sprain strain from over exercising, because people are doing crazy things now by themselves, but everything else is mostly emotional, not feeling well, stressed out, things are going on, everybody's a little bit freaking out.
Right.
I'd like to add a few thoughts to that as well, because I've seen some significant changes in my patient population. And again, I treat kids, but I also treat young adults and older adolescents that basically present as adults. And I can think of 4 changes right now, major changes that I've seen. And one is an increase in chronic pain. So if you have patients that are dealing with chronic pain, chances are the chi and blood stasis is going to be more extreme due to lack of exercise. And also just the kind of shock. We've all gone through a certain kind of shock with the political events that have been going on, and then with the pandemic. And, we know that's kind of suspends the chi. It kind of just, so I feel that I have seen an increase in chronic pain patients. Their pain scales are higher, or they're having acute flares of their chronic pain. So chronic pain, number 1. Number 2 is more anxiety and mental health complaints. Just people coming out of isolation, having their own anxiety for so many good reasons right now, and not having the necessary or the normal support tools in place, the social structures and the activity structures that help to buffer against mental health concerns and anxiety and depression and isolation. So chronic pain increase, anxiety and mental health increases. I think that trauma, I'm seeing for patients where there is trauma, that I'm seeing an increase in trauma presentations. And, trauma can present in so many different ways, but, as you pull the thread, it goes back into that piece. And we're seeing an increase, in a society in domestic violence, and these types of conditions seem to perpetuate more violence in the household or lock people into these settings. So I think that there's more trauma that is activated in really so many of us, if not all of us right now, and especially for our patients. And then also just dysregulated sleep and other patterns. So the things, the structures that keep us kind of flowing with the rhythms and the cortisol of the day have changed. And especially with kids, they don't have school to keep them on schedule. And so the eating patterns and sleeping patterns are dysregulated, which then can lead to more mental health and chronic pain also. So it's kind of a big basket. So for those 4 things, I would say just a couple of resources. I think that the ASA and NCCAOM are having their weekly town hall tomorrow. That's every Wednesday. And I think they are talking about mental health tomorrow, I think is the topic. So sign up for that and don't miss that free opportunity with free NCCAOM credits. And when it comes to trauma, there's an amazing new resource in California that's not just for Californians, and it's called the Adverse Childhood Experiences, the ACEs program that has been created by our Surgeon General in California, Nadine Burke-Harris. And it's a training that anyone can take online. It's actually a training that I think creates incredible potential for California acupuncturists and beyond to be better at screening for trauma and treating trauma. We know we have so many tools for that. So you can check out resources, just plug in California Surgeon General ACEs, ACES, and that's another great resource to just deepen your understanding of trauma and how to screen for it, identify it in patients, how to talk about it. And then of course we have incredible tools to apply for that.
I think just to add to that too, one of the shifts that I've seen, is that okay, Jeff? Can I add to it?
Please.
Okay, just to make sure. I think what I've seen is sort of the divide that exists in this country has just gotten bigger, right, in every realm. And so folks are either ridiculously busy, like if they were busy before, that's a whole new level of busy, right? And Zoom calls means that you don't get breaks, right? I have so many of my patients who literally are on Zoom calls for 12 hours straight, thinking about the eye strain, the liver, right? On top of being forced to sit at your computer all day, right? And then folks who don't have anything to do. And so potentially are sort of faced with the demons of who they are and their traumas and all of that stuff. And so it's been really interesting to kind of see those two different sides. But the one unifying factor is that sympathetic tone is on fire right now, right? Everyone is just so their sympathetic nerve is just exhausted, right? I'm sure you all feel it too. I'm very thankful that I have a supportive family and, honestly, that I have a 16-month-old who is completely unconscious of what's happening, right? That's so lovely to have right now where I'm not, disconnecting, but I'm actually connecting at a deeper level. And again, I think patients help us with that too. But I'm seeing a lot of patients who, maybe they bought, as I'm in Chicago, right? So I see a lot of patients who maybe live in a small apartment because they work all the time. And now they're stuck in their tiny apartment by themselves, right? I've had a handful of patients who say, you're the only person who's touched me for the past, 12 weeks or whatever, which is kind of intense, but that's real. This is what's happening right now, so I think that it requires us a whole new level of support that we're already great at supporting our people. That's what we do. That's why they come back to us. That's why we're part of their families and their support systems, but it's a whole new level now, I think. And it requires us. One thing I do want to say is that we have to be really on point with where our energy is at. And so Qigong is just non-negotiable anyway, but whatever it is, whatever practice you do, you really have to ratchet it up because if you're nervous, your patients are probably nervous too, right? And so, and even, I get it, Irina, I don't have people asking me about, our safety practices, but I think it's because we have 3 layers before they get to me. So by the time they get to me, they've already felt, assured that everything is okay. But I would say that that's a really, really important thing. And there's so many great resources out there. I think all the webinars that have been going on really to support us, to support our knowledge base, to make us feel more confident in the amazing skill sets that we have has been really helpful during this time and helpful for our patients too.
Thank you so much.
Yeah. We all need to gel, mask, and everyone needs a shenmen, at the very least. So
totally.
Part of the getting ready process. So I'm curious from you guys. So are you guys documenting your cleaning procedures? Do you have a process for that?
No, we're not documenting it. It's just inherent and we talk to our patients about it. Yeah. Okay. But we have documentation for all of our clinicians, but we don't share it with our patients and we don't put it in our charts.
I have it as a display next to the front desk on the wall, what we do, our precautions, and for the patients, what they should do. And that's about it, a display.
Okay, perfect. And it's like a framed picture.
Yeah, it's a pretty thing in a frame, a nice flyer that has nice pictures and big letters for them, what they need to do. And then for us, our procedures, on the wall, printed out. And this is what we do between patients, before patients, after patients, in case we forget.
Yeah, and I'm not documenting in each chart. However, I did develop guidelines, and in part so that other services, again, I'm at a major medical center, but so that other services could understand. And if you are doing integrative medicine with other, if you interface with your patient's MDs or their other specialists, then that might not be a bad thing to have your guidelines written up. And also, I wrote it down just so that I would stay true to it for myself as well, because my heartstrings can get pulled and I can want to maybe, break my own boundaries and rules. And so it's good for me to have that written. So I say, okay, stage one, this is just stage one, stay with it. And so it was good to develop guidelines.
How many of you guys are using gloves for taking pulses and for touching patients? I'm not, just so you guys know, I am not coming at you. I really
don't judge us, Jeff. Stop trying to judge us.
Definitely not me. No.
No. Well, so these are all questions from the audience, and they really want to know what you guys are doing. And we're not saying that what we're doing is right or what anyone here has done, but they're just saying this is, they're following CDC protocols, they're following OSHA guidelines, they're doing what feels right to them. But if you guys, so none of you guys are wearing gloves.
I've worn them for some patients, and I really kind of let it be a patient preference because, again, we know we wash our hands all of the time. I've always worked under the assumption that someone's carrying something that they don't know they're carrying. But again, it's about making the patient feel the most comfortable possible. So if I have a patient who's coming in with all of the layers and gloves and, I had to hold the door open for them, then I'm going to wear gloves with that patient because it's about their level of comfort.
Yeah. If anything, I teach the patients how to take the gloves on, and I will give them a few pairs so they can actually change them, because what's the point of having gloves and touching everything? So if anything, I educate them, say, this is what you do, take one, take it out, then throw it away, put the next pair on. So I don't wear, only when I clean. When I clean everything, I wear gloves, not to destroy my hands, but otherwise, I'd rather not take the pulse than try to feel it with the gloves.
Yeah, I agree. I think teaching our patients is a big part of what I'm doing too, because they don't understand that, there's this false sense of security, I think, with gloves. So people are like, oh, they touch this. Okay, I'm good. And then they touch their face and they're like, yo, if you're not trying to touch that, what are you doing touching your face? That's okay, right? This isn't top of mind. So I think there is a lot of education with that. I just see this when I'm at Costco and I kind of want to go up and be a helpful Samaritan, but then I don't want to get yelled at for being too close. But I will say that definitely when we're pulling needles, it's the same technique that we do with CNT, right? And then when you're changing sheets and stuff, and that's based on the CCAOM guidelines. Yeah. But I'm also really thoughtful about sharing or being thoughtful about wasting gloves too, right? I want to be, there is a shortage. We have no shortage in our clinics, but I know there's a shortage in the grander scheme of things. We do want to be really thoughtful about that.
I do want to add that I don't have any sheets anymore. Everything is disposable. Everything is paper. Everything is paper. The tables are not as pretty or cozy as they were before. I took everything off, so I just use table paper, which I throw away after each patient, and the pillowcases are paper, everything, drapes are paper. So no laundry of any kind.
And I'm only wearing gloves for the patient population that I would have worn gloves for prior to this. I always do a hard wash before and after patients, or, anytime I touch patients, and then, hospital life is gel all day. So that hasn't changed for me. And in part because I'm a little bit of an awkward needler with gloves. So if I have a choice, I'd rather use my hands, and with palpation, I find that it's also hard because they're just not as temperature sensitive. And because I work with kids and many of them are nonverbal based on age or communication levels or disability, then my palpation is ever more important to the information that I need to provide a good treatment. So sometimes glove can be a barrier, and I am trying to use as little PPE as possible for my service. But, so I didn't make that change. I know many acupuncturists some patients want them, and I encourage people to some degree, if we're all having a baseline, to then gauge the level of protection you feel you need to be comfortable from there.
Are you guys taking temperatures before people come in the office?
Yes.
There's no wrong answer. Okay, so Nella is, Lamia is. Irene, are you taking temperatures?
No.
No. Okay.
I should. It's it's in my mind that I probably should, but I almost feel like people who are not feeling well, they're not coming in. And you can have low-grade fever. You can have temperature for so many different reasons. Like, yeah.
And my patients are vital. They have their vitals taken every few hours. So, and I do think there's screening for visitors at the door for temperature.
Yeah, I think for us, it was just for their comfort and just to ensure that if they don't have thermometers at home. But I'll tell you, we didn't start doing that until a couple weeks ago because we couldn't get them, right? Getting those thermometers that don't actually touch the skin, they were really hard to get. I don't know what kind of connections, but we managed to get some finally. I think they're a little more available now too, but yeah, but definitely it wasn't something until we started until not too long ago.
Are any of you guys currently cupping? And if you are, can you share maybe some protocols that you've taken to be a little safer? Not all of you at once.
I'll be plugging Lhasa. I love the disposable cups that you guys sell with the pump gun. There are also for plastic cupping kits, there's the inserts. So we don't use glass, at the hospital, and fire is not welcome here. So I use hand pumping. I don't do a lot of cupping in my service. However, I did do a cupping treatment today for a patient, and I love the disposable cups that you sell. That you guys, I think it's very affordable, and the pumper can be washed and cleaned with hydrogen peroxide wipes, and then the cups are single-use disposable, very affordable, great product. Thank you for carrying it.
Perfect. Anyone else? And then
we use the same precautions we did before.
Yeah, it's the same thing. I mean, we always clean them. Like, why? Yeah, I don't see the difference. You always want to make sure that they're clean and sterile, and you don't cross-contaminate anything.
Exactly. I think
I do use
if I were in a
gloves,
hospital with kids like you, I would probably use plastic ones that were disposable. But I think, yeah, we just do the same high level precautions that we did before, because cupping is so necessary right now, especially with folks who are starting to feel like the body aches and you're concerned maybe that something could be happening. Cupping is just everything. So I'm happy we can still do that.
Are you guys using any different types of PPE for tongue diagnosis, like shields or goggles?
No, I'm not. I will say for like virtual consults, it's really hard with the grainy, connection. So I have people send a picture beforehand, and then in person, no different PPE, hoping you're not spitting on me, but I have my PPE on, so.
And then do you guys have,
just ask them to take the mask off for a second, and it doesn't take long to figure out what's going on. And if they're not comfortable, they don't need to do that.
I plan to wear a visor when I return to ambulatory care. I think we're still a few weeks out from that. I just saw, I think it was referenced that the World Health Organization is encouraging more visor wearing, actually, seeing that there have been more cases of transmission through the eyes, through the mucosa of the eye. So, but I'm not there yet. So that's my plan. And again, plans change in this world right now. So my plan, and I think my colleagues that are practicing ambulatory care at the OSHA Center are wearing visors. Shields.
Yeah, I was kind of again, I can see why you would do that, Ra. I am not a fan of wearing those visors. I think they're creepy. They're also unattractive. They're going to mess with my hair. But I also, what I do is I have them stick out their tongue when I'm far enough apart, and then I come a little closer, take a look, and then step back, right? I'll have some patients who, if they're not comfortable taking off their mask, I'll have them take pictures as well. But there's so much. I mean, I think I have Giovanni in the back of my head saying, you need to see it in natural sunlight. So there's nothing more oppositional to that than an iPhone, right? So it's ideal to actually physically see if we can. But I agree. Once their mouth is open already, they're not moving their tongue around, right? So I'm not worried so much about the spit. Yeah, so just a little tweak there, but I think it's still doable.
Do any of you guys have your patients take the mask off when they're laying prone, or do you have them keep them on?
I can answer. I will say that most of my patients actually want to keep it on. And I am concerned. I always ask, are you okay? Are you comfortable? Are you breathing? But it seems like they are okay with the mask on, prone. Yeah.
How about you guys?
I've had people do both. I leave it up to the patient. But people have been perfectly comfortable doing it. I don't treat a lot prone anyway. I do side lying. But yeah, people haven't really had much of an issue with it. And if, you know, people are just like, I really feel like I can't breathe, that's fine. I'm going to keep my PPE on and I still have to clean regardless. So.
I ask my patients to take it off unless they're uncomfortable. I think it's really important for them to breathe. That's how you move chi. That's how you move blood. And but if they're uncomfortable, it's not worth it, right? So you try to. We're all kind of in this game of trying to be as flexible and creative as possible, right? Without completely deteriorating the potential of the treatments. So to me, being able to breathe is, because we're treating so much anxiety, is really important. And I don't know about y'all, but I've been seeing a ton more lung issues that are not coughing and stuff like that, but so much more grief. Obviously, there's many reasons for that. You know, it's just, there's a lot of that already. And skin issues, I'm seeing more of that, I think, all really tightly related to the lung. So it's hard for me to have them to have them covered. I think it can really take away from the treatment. But if that's their comfort level, I have to respect that without question. Yeah.
I must say that I dab a little bit of essential oil on the mask, and that seemed like a magical treatment for everybody, because they get this abundant essential oil, whether they face up or face down. So it doesn't seem like they're just being blocked. They're actually getting essential oil treatment while they're with the mask on the treatment table. So that's kind of cool.
And for my patients, I have the option to ask patients to wear a mask. It's, you know, the way I see my work doing inpatient care is that it's a series of home visits, because while patients are here in the hospital, I see the room that they're in is their home while they're here. So, however, the medical center has given all practitioners the space to ask both, you know, patients to wear masks, and then visitors are supposed to wear masks at all times, just as all caregivers are. And, you know, and it's hard. I don't really ask my patients to put on masks. I feel like, you know, again, they've all been tested, and so it would be a different type of exposure level. I know that these masks can be irritating for many people. I think I heard that there's a fiberglass component to this, and I'm not sure that that's true. I haven't verified it, but they also have yellow surgical masks that a lot of people do better with. So I think if you're considering providing masks for your patients at the door as a service, you know, I know some people are having patients bring in their own masks. Some clinics are providing masks at the door. Then I would recommend to look into both a blue surgical mask and a yellow if they're available and abundant, because there are some people that will have irritation from this. And just for myself wearing this all day, I noticed that I did have increased headaches. During the day, I have to get outside, take a break, and go get some fresh air, because there is this kind of rebreathing carbon dioxide and whatever else the mask is made out of, and just not having the same flow. It's easier to get winded in this if I'm kind of hurrying down the hallway. So I found it's important for me to have a break for myself in the day, to take my mask off and breathe naturally, do some qigong and open the lungs. Otherwise, I go home and I'm tired and have a headache at the end of the night. And I also have had to stay better hydrated, I've noticed as well, returning to practice more than ever. I'm not quite sure why, maybe the stress.
Are any of you guys doing cosmetic acupuncture treatments or points on the face right now?
I am. What's the question? Sorry.
So can you share a little bit of how you're doing that? Because I think a lot of people are curious of, you know, how to treat someone face up without a mask on and things like that.
Yeah. So I have not treated someone for cosmetic acupuncture without taking their mask off. I think that would be like amazing. Like maybe they only have one concern here, but no, you don't have to take your mask off for it. I will say when this first happened, and everything non-essential had shut down in California, and a lot of my colleagues were not operating their practices, I was not doing cosmetic. I was really trying to focus on, like, look, I'm trying to keep people out of ERs. I'm, you know, trying to act as an essential service. That being said, I normally do microneedling. I normally do cosmetic acupuncture, and it's very popular here. So I was eager to get back to it. I started doing about a month ago, cosmetic treatments again. And they just, again, it's their preference if they want to wear a mask or not. And when they need to take it off, they'll take it off. So it hasn't been much of a change, because I do have patients who won't wear a mask even if they're not getting cosmetic acupuncture.
Anyone else?
I don't really practice cosmetic acupuncture yet. I'm talking to Shelley a little bit this week, I think. But we, you know, for folks, I mean, it's allergy season still somehow. So, you know, for folks who have like congestion, I really love doing Li-20 Vtong. So I'll do that on them, do 24. Yeah, so kind of the same protocol that I talked about before. I do want to be clear, you know, like I think maybe I don't speak for everyone here, but I think I do, in that like we're trying to share our experiences, and you know, if that's not, you know, if you have any concerns about that, you're welcome to not be my patient. But I think that it's important, like this is kind of what we're doing. This is what we feel safe based on, you know, what the CDC guidelines are, what the highest level guidelines are. Right. And I'm not interested, because I'm not a single practitioner. I represent a large company. We're not interested in messing around either. Right. And I think, you know, all of us are in kind of similar boats, right? Irina, you have a whole crew. Ra, you're in a hospital setting as you are. Nell, you are going to be bringing people on. Right. So we're not trying to, we take this very seriously. Right. I think that we can all agree on that. But, you know, I think, again, we're trying to share sort of our guidelines, but you have to do what you're comfortable with. If you feel uncomfortable doing these things, just don't do them. It's okay, right? I mean, as far as like, if you feel like you need to do more, I should be clear, then do more, right? You have to, this is your intention. It's your practice. It's your license.
Lami, I agree with that so much. And just for the facial question, I think I've seen amazing resources being offered by Michelle Gellis. I haven't studied with Michelle, but I even saw these little masks that I think it was one of her posts that she posted. So I think she's a tremendous resource for people that want to understand how to best do that right now. She has a lot of experience and is one of our teachers. Yeah, I agree, Lami. I think we're all just trying to figure this out. And as a profession, we're trying to be awesome through this and continue to show how valuable our medicine is, and really how this time is presenting. I think our patients need us more than ever. And I think this country needs our medicine more than ever. And this pandemic has revealed that and pulled the covers on pre-existing conditions that we're so good with, trauma that we're so good with, so many things that our medicine has to offer. And I just do advise people to keep sharing beyond this, this type of setting, and also to trust that feeling, trust that gut feeling when you get that buzz that says, something doesn't feel right here. I mean, I think we all create these standards and these best practices. And of course, we want to follow the minimum guidelines. But above and beyond that, I think it's really important as clinicians that we use our intuition right now. And if you feel that you need another layer, or you want to do something differently, or something is not working and you get that buzz, listen to it more than ever, because nobody knows how to navigate this. We're all figuring it out together.
Yeah, I think patience with ourselves and patience with others is kind of the key theme right now. I think we, as people who want to do a lot, we tend to maybe be impatient with ourselves sometimes. And this has really taught me to be a lot more patient with myself, but absolutely with others too, right? So if people, call last minute to cancel, we're not charging them, right? Just little things like that. If people are running late, it's okay, right? I think it's okay anyways, but, where it's like, man, you completely messed up my schedule. I need to take a deep breath and be like, who knows what is going to be unpacked in this room right now, right? So I think that is it's so important, and calling people out and all of that stuff. I think that those voices have quieted down quite a bit. I think we've come together as much more unified than we did before, which I think is really one of the beautiful things that has happened during this time.
Thank you so much. My next question is going to be for Irina. So I have a feeling, based on where you work, that you probably have shared spaces in your office or in your building. So how are you managing? Are the bathrooms shared? Are for the waiting area, things like that?
Sure, it's actually a really good question, because I just expanded. I took a much bigger suite with more treatment rooms at the end of last year, and when we were setting up, finally I made it all nice and pretty, and then like, wow, this is nice. My waiting room is small. I only have 3 chairs, but I never have anybody wait, like 5 minutes tops. People come in and they get taken into the treatment room. We never overbook. And then I actually had other practitioners reach out to me and tell me that they lost their space, because people, when they sublease, if something happens to the main leaseholder, and it's happening everywhere in the city, businesses are leaving, they are closing, people are losing their space. I had 2 people join, pretty much come in and join me and rent space from me. I turned my back office into a treatment room, There is no more computer room. So I added the treatment room instead to be able to accommodate other practitioners, and it became a much better dynamic because even though I'm like all Eastern acupuncture, I think we can do anything, but we don't do bone setting, you know? We don't do bone setting. I can't do bone setting, but I do know sometimes you do need to adjust that spine to create the traction, which I cannot do. I'm small and I have no skills. I have a chiropractor who joined in my space, so the patient can just walk over, get an adjustment, and come back on my table, and we continue. So this integrative treatment actually became much better. So I do now have only my own space, which I love because I like everything perfect. Like everything is like perfect. Nobody's waiting and everybody's addressed in the proper way. Quality of care, standard of care. I think it actually made my practice better. And I think it's going to make everybody's practice better. It is very big change. It's everything at the same time. Even my EMR, I changed my EMR usage. All of my software had to shrink because everything is designed for much bigger practice, and I'm much smaller now. I had to cut my costs. And now the people are coming in and it's changing and transforming. So one bathroom on the whole floor. This is Manhattan. So you have a bathroom that's everybody from the floor, all doctors and all other offices go to use it. So people just need to do what they need to do. And when they come back into the office to do their own thing, the usual thing. Yeah.
Does anybody else have anything to say about shared spaces?
Yeah, could I add to that? I'm in a 7-story medical building. So what was great about that is all of the proper documentation, all the proper signage was up on the front doors, on the elevator doors. They were 6 feet away from each other, markings, only 4 people allowed in the elevator at a time. And in Beverly Hills, it's required to wear a face covering when you are walking around or going to. So like, people were already on board with that. But yeah, there's one bathroom on the floor. You need a key for it. So if people are using the bathroom, they're grabbing the key. And it suddenly, makes you realize what's really essential and what's not. And I never had people waiting either, but if they walk past 15 other suites from the elevator and there's, nurses standing from the women's center right outside, like it's very difficult to control everything outside of the treatment room. So that's been part of me reevaluating everything, because I don't think we're not going to just go back to normal. Right? Like it's not going to be like, oh, now things are reopened, so nobody cares about sitting right next to somebody. This is something that's going to continue, and it's conversations that are going to continue, and it's flexibility that we all have to have moving forward. So when I'm looking at office spaces now, rather than looking at like, oh, what would be this amazing waiting room with like room for the TV and this great build out, I'm like, okay, I don't need that. What I need is more room within a treatment room, so I'm not on top of somebody all the time. So I think we're just going to have to keep in mind that there's a certain amount of flexibility that we need to have going forward, and that we're not going to just flip a switch just because things are reopening. Like people's attitudes are not going to go back to where they were. I think there's going to be an expectation that you have a virtual option, to do a consult. I think there's going to be an expectation that you have a procedure for how people are supposed to come into your office and not have to commingle if you are in a shared space. So yeah, I would just encourage everyone to kind of keep that in mind, that we're saying these one things today. It could be, continuing to evolve and very different 2 weeks from now, 4 weeks from now.
Can I just have to piggyback just for a quick second, if I can? And this might be going slightly off the topic, but I know we're going to end soon, and I have to say this. We're not going to go back. Like Nell said, it's not going to be the same. We're changed. We're changed by everything that's happened, our view of each other, and also the readiness for another pandemic, whether it's another round of this, which we anticipate, all the infectious disease experts at UCSF. By the way, there are free UCSF town halls that happen every week. They're incredibly informative, that you can Google and research and sign up for, that are incredibly helpful. So, it's not just what's going to come in the fall. We're seeing so many changes. We're going to anticipate another pandemic. We're not going back. We're in a new baseline, and medicine is changing, and it's changing quickly. Here at UCSF, we were doing, I think it was less than 10% telehealth. And now, then we switched to about 80% telehealth. And, it's not going to go back to 10%. Many of our patients have said, hey, I love this telehealth. I don't want to commute. And sometimes I need maintenance and I don't need to be seen. And so as a profession, we have to not just to adjust right now. We also, and Nell and I both are part of CCAOM, and Lami has been part of her associations, and we have to stay on top of this politically as a profession. It's not just how do we deliver great patient care. That it goes, delivering patient care, it means making sure that our services are available, affordable, and pay living wages for our practitioners. And we're going to see changes, fast legislative changes in telemedicine, who can do it, who can't, in who's considered essential and who isn't. Every state is reevaluating that right now. And they want to change that list based on their experiences through the past few months. And if we fall off those lists of what are essential businesses, right now in California, we've been considered essential, and that is likely to change if we don't get political. That's on the table right now, whether we are essential providers or not. And this is going to happen at every state level. And if we are not on top of this through our state association, through NCCAOM is doing amazing work, the ASA, which is the culmination of all of our state associations, the American Society of Acupuncturists, is doing incredible work for our profession. So this is a local effort of education. It's a state effort of making sure that we have the status that we need to keep going and expand to make sure our services are available for our patients. And national level, making sure that we're involved in the healthcare changes that will be happen. And so more than ever, even though we're facing such financial difficulty, we have to engage with our professional associations with membership and participation. Otherwise, the fast changing climate allows us to make great gains for our profession. But if we are not active altogether in that, we will be left behind, and our medicine could potentially be adopted by other practitioners that make the cut. So we have to engage now more than ever. Sorry, I had to plug that. It's so important.
Thank you, Ra. No, that is a very, very important message, and we'll share it till we're deaf. So thank you. We do have some more questions coming in. A lot of good ones. We might not be able to answer everything. So some questions that we've actually had multiple of. Have you guys removed all decorations from your offices?
Not at all.
Nod your heads.
Not at all. If anything, I made it even prettier. Yeah, it has to be comfortable.
I knew I liked your style.
It still looks nice in my office. Like, I haven't really removed anything. Maybe there's fewer reading materials. I've been better about making sure everything's cleaned up really nicely, but things have stayed.
Yeah, we removed our magazines and stuff like that people could share and commingle with. And then we have cleaning, Clorox wipes sitting on top of the water dispenser. People need to drink water.
Yeah.
So they're able to clean right afterwards. And our clinic managers are hawks, so they know. They clean up everything after everyone walks in. So.
Are you guys serving tea, water? Well, you obviously, let me say you have water bottle, but you're not actually serving it to the patient. They can help themselves.
I mean, sometimes I serve it to them, I guess. But usually they get it themselves, yeah. But yeah, I'll bring them water if they need it. My hands are clean and the cups are clean. Yeah.
A lot of people want to know which platforms you guys are using for telehealth visits.
I haven't done telehealth, so I only use Dr. Krona for my EMR, and I know they do have everything that's up to date and all compliant, but I'm just hands-on. I need my hands on people. I don't do anything virtually.
We're using Zoom for UCSF, and it's a secured platform. If you are using Zoom, I make a couple of recommendations. One is that you do have a meeting ID or a password, that you have a password. So that way there's no bombing that can happen. I guess that's what they call it, right? Is Zoom bombing. So having a password is important. And then you can also enable your waiting room for your patients. So that also is another added layer of protection. And I do advise including a telehealth statement in your charts. So if you're seeing a patient via telemedicine or telehealth or video visit, whatever you call it, that you enter that and say that this visit was performed in this way with the consent of the patient that you have. There's language available out there for it. If not, you can contact me at CSOMA to get more of it. But I do recommend noting that for telehealth visits. So that's what we're doing here.
And have any or all of you updated your consent forms for COVID? So I think I've seen a lot of people out there saying that they're, basically saying that, they're adding language into their consent forms, basically saying that by coming here, you are, kind of putting yourself in harm's way, I guess, with, for lack of better words.
I think I mentioned that we have people sign something when they come in. So yeah, we did. And then to Ra's point, I think that, we're doing very similar kind of things that they're doing. Sorry, I meant to say we're using Zoom. Yes, I was like, that was not clear. We have it built into our platform, so we've been using it, and it's same kind of thing where it has that the meeting room and it has the waiting room as well, and it's integrated into our EMR.
And for anybody that's looking for telehealth information, if you visit the Lhasa OMS blog, we actually have some really great resources on different telehealth platforms, different EHR platforms, things like that really cater very well to telemedicine. We also did a webinar a few weeks ago with Dr. Jennifer Brett from the CCAOM, where she went through all of the CDC and OSHA guidelines, especially in regards to clean needle technique. So I do recommend visiting the Lhasa OMS blog and checking out the recording of that webinar, as that is a little bit more of the laws and regs side of things. This is more of practical application of those laws and regs. So, kind of last couple questions. Are any of you guys doing anything to prepare for a possible, second wave of COVID in, the fall time?
Yes, in that just what I spoke to earlier about being prepared for this being a very fluid situation and continuing to really communicate with your patients. I think for those of us who were able to stay open or, maintain some level of patient care at this time, that communication was really important. And just, being as transparent as possible with your patients and, the people that are normally part of that support system, whether that's other practitioners that are kind of part of the care team, because it is so fluid and it is so different every day and things aren't going back to normal. So really that preparation is about just knowing that something will be down the line, even if it's not that second wave, and we have to be able to continue to adapt.
I'm doing a lot of evaluation about what's working and what isn't, and just trying to learn from it and really looking at the numbers, keeping stats on my service, and just trying to understand how to innovate continually and be better.
Yeah, I think we've all kind of learned that you're just going to constantly be on your toes, right? That's part of that sympathetic tone for us being in the clinic, right? I think we're constantly being creative, being curious about what else is out there, being flexible. I think that's one thing as we start to bring more folks in, kind of getting them up to speed on that, right? Just be ready for, for instance, one of our clinics is out in a suburb and we opened it up for the first day today. Well, they were supposed to have a protest, so they boarded up the building. Cool. How are we supposed to get in? Right? This is reality, right? So we made it work. And that's just, you just never know what's going to happen at any given day. So thankfully, inherently, as clinicians, I think we are creative. So it makes it a little easier, but being okay with being uncomfortable is sort of what everybody's figuring out right now. Our patients and us as well. So, as far as being prepared for a round 2, if that happens, for sure, right? Everyone kind of knows, everyone set themselves up hopefully for that. I know a lot of people, when I was talking in the webinar that I did with you guys in March about telehealth, one of the things I was mentioning is, this is like, if you have free time, if you're at home and you can't practice and you can't do what you love, you can still do what you love, right? So create content, like a lot of what Ra was saying. That's a lot of folks on my team who were in the clinics but weren't quite as busy. They created videos, they created collateral, they created things that they were passionate about. I wasn't like, do this, right? I was like, what are you interested in? And they said this. I'm like, awesome, do it, right? That's what's going to shine through in whatever it is that you create. So, if you still have a little bit of a lag time, take advantage of that, right? Get super serious. This medicine is super serious. We're not a joke. We're at the same level, if not higher level than other clinicians who are in complementary medicine. And it's really, really important for us if this has showed us nothing, it's just how serious and how important we are, right? And how essential we are.
Jeff, I want to add just a couple more resources that I hope are being put into the chat. I'm not sure if my putting it in works. So CCAOM is the California State Association, but we have resources there for anyone across the country. So feel free to check out ccaaomonline.org. And there's a great link from there to what we call the CCAOM network that we created several months ago when COVID started to just keep this discussion going. And because there's only so many times, we wanted sharing back and forth. And so the CCAOM network is a great way. You can join it for free and get updates and share what's happening and your questions, and everyone's supporting each other in that network. We have 1,500 members and it grows every day. So please check that out. And then we also have a class that's geared towards the COVID world marketing. How, as you're reopening, are you going to remarket your practice? How do you reach back out to patients? So that's a CE class that's happening on Thursday morning. That CCAOM is offering is for California practitioners or anyone in any state. There are NCCAOM credits, and so please check all that out at the CCAOM website. We're trying to be here for everyone, especially our California practitioners, but everyone.
Thank you so much, Ra. And just, so actually we're going to wrap it up at this point. We're getting to about 90 minutes for the event. I see Cynthia's joined us. I want to thank all of the panelists. You guys are amazing. I consider you all friends. I really enjoyed everything that you guys had to share tonight. I know the audience really appreciated hearing everything that you had to say. I hope it calmed some people's fears and maybe, calm some of the anxiety of going back to work, because, it's really not that different. And I think that's what I gained from this event. I'm going to turn it over to Cynthia, but I do want to say everyone have a great night, and it was such a pleasure being here tonight.
Yeah, from Pacific College, we just want to say thank you, Irina, Lamia, Nell, and Ra, for a wonderfully informative webinar. You are inspiring. We appreciate your spirit and your spirit of generosity. We look forward to continuing to support you and watch you in your practices. And thank you for supporting all of the people here on the webinar tonight. We'll see y'all next time.
And I do want to mention one more thing. We actually do have a free webinar that's actually going to be happening next week on Thursday. It's going to be, on Tuesday. It's going to be on SEO. So please check out the Lhasa OMS blog for a free webinar on SEO happening on Tuesday, also co-sponsored with the Pacific College. So again, thank you to everyone. Thank you, Cynthia. Thank you to the Pacific College. It's always a pleasure working with you. And everyone have a great evening.
Thank you.
Thank you.